The OCD and Anxiety Podcast by Robert James Coaching. Hello and welcome to the OCD and Anxiety Podcast, where we explore how to have a more positive relationship with anxiety disorders, taking back control so that you can start living the life you choose and not the one chosen by your fears. Hello and welcome to episode 5. Today I'm joined by Lisa White, who is a licensed psychotherapist and clinical social worker with over 20 years of practice in community and hospital settings. She is a graduate of Smith College School for Social Work, one of the oldest graduate programs in psychiatric social work, and where Sigmund Freud first lectured in the US. She was trained in psychodynamic and analytic psychotherapy. She now uses the principles grounded in CBT, DBT, and trauma-focused therapies to care for patients facing the most severe mental illnesses, to those coping with daily challenges of anxiety and depression. She now works for a large behavioural health provider in the US, maintains a private practice, and provides consulting and supervision services for staff at Safe Place International, an NGO caring for LGBT refugees in Turkey and Greece. In this episode, we discuss Lisa's experience of working with people with severe mental health problems such as schizophrenia and how she's helped them to learn to overcome their battles with anxiety that they tend to have about their mental health problems. Lisa gives loads of really practical tips for dealing with anxiety, and we also discuss in detail panic. And Lisa again gives us some really good examples of ways that you can deal with panic so that when you're in a situation when the panic is coming up, you have some really practical, useful skills that will help you to be able to deal with that. It's a really interesting episode, and Lisa's in-depth knowledge and years of experience really shine through. I really hope you enjoy it, and remember, if you'd like to get in touch with me, please do. You can contact me at Instagram at Robert James Coaching UK, or you can go to my website www.robertjamescoaching.com. Many thanks. How are you doing, Lisa?
I'm fine, thank you. It's a great day.
It certainly is. Thanks a lot for coming on the podcast.
You're welcome. I'm glad to be here.
Okay, so to start off with, can you tell us a little bit about yourself and your history, like working with mental health problems?
Sure. Well, to get far back there, I actually had no interest in psychology whatsoever when I was a college student. I actually was interested, much to the chagrin of my father, in poetry and philosophy. And so my undergraduate degree was in poetry and philosophy.
Wow.
I know how to write a sestina, for instance, not a really useful skill. And so when I graduated from college, I had a little bit of a crisis, and I said, well, what am I going to do? Well, it just so happened I was almost already married at that point, and my father-in-law was a psychotherapist. And so I thought, well, maybe I'll be a psychotherapist. And so I went back and did some study and prerequisites, and then applied to several schools, graduate schools, and found out that I really loved it. It was the closest thing to reading and writing and, discovering people was, in psychotherapy, it's very similar to that.
Yeah, absolutely. Fantastic.
Yeah.
So it was a family influence.
It was definitely a family influence. I didn't even actually, it wasn't really conscious. My father was a pharmacist and my mother was a bookkeeper. But my uncle was a psychologist and had worked for the VA for his entire career. And both of his daughters, he had 4 children, both of his daughters were clinical social workers as well, and working in different types of fields, whether one psychotherapist and one in victim advocacy.
Okay.
Yeah.
Wow, really, really interesting.
Yeah.
Great. So can you tell us about what type of therapy you work in?
Sure. Well, most recently, I worked in a psychiatric hospital in the U.S. And psychiatric hospitals have changed since I even went to graduate school. As there are very few places where people are hospitalized on a long-term basis. And I worked at a hospital that was a short-term hospitalization program for people who were in crisis, were either suicidal or psychotic, for instance, and they were there for anywhere from a few days to a few weeks at a time to get stabilized. And my role there was I was a group psychotherapist. And so I conducted a lot of groups, sometimes 3 groups, 4 groups a day with people in an effort to stabilize them and get them on their way, assess them, stabilize them, and get them on their way.
Wow, that sounds really intense.
It was extremely tiring, but it had followed a bit of time. I'm going to have to pause for a second.
Okay.
So my job at the hospital as a group psychotherapist had followed a period of time where I was only practicing part-time, and I had been involved in being involved in starting a Waldorf school, a Steiner school, when my children were little. And so I got back into the thick of it, the weeds of it, and I was so happy that I didn't forget anything that I had learned. I was afraid that having children and focusing on the school was maybe I'd forgotten something, and I don't think I did.
Oh, that's great.
Yeah.
So you worked primarily with people with quite severe mental health problems?
For the most part, or people for one reason or another were in a period of crisis, but usually people who presented at the hospital or were remanded to the hospital involuntarily usually had a major mental illness, such as one of the bipolar disorders, or schizophrenia, or severely depressed or severely anxious, often maybe a substance abuse problem or lack of social support. Lack of support was involved in it too.
Yeah. Okay. And so I imagine, obviously, because the podcast we're focusing on OCD and anxiety, but I imagine a lot of these people had very, very serious anxiety problems that were co-occurring with the other issues that they were having.
Absolutely. Anxiety actually is a sort of cardinal symptom. For any kind of emotional or mental health problems. Just because we have people who have schizophrenia or bipolar illness, for instance, may have persistent and chronic anxiety, but just because you have anxiety doesn't mean you have bipolar illness or schizophrenia. Everybody, I don't want to say everybody, but probably everybody has experienced a degree of anxiety in their life. It's just a matter of how persistent it is, how frequent, how severe the anxiety is, and if there's an underlying cause for it. But I like to think of it as the brain is not at rest. So
absolutely, yeah. I think that's definitely true for so many people with anxiety, is that they're kind of stuck in their head, and their brain is just not leaving them alone. They're worrying and stressing, almost like 24 hours a day about different things, and that's causing the problem. It's like they can't get out of their heads.
Right. And there can be, it's interesting because there can be it's really almost a physiological experience, because when we have anxiety, oftentimes we have a physical experience of that. When we think of the acute anxiety or a panic attack, that's really manifested in physical symptoms, right?
Absolutely.
So I want to take a panic attack, for instance, or an anxiety attack. There's different words for it. Of course, there's official words or clinical terms for it. People can have a panic attack without developing a panic disorder. Having a panic attack can be a very disorienting experience, a very frightening experience. In fact, people sometimes will have one and they present at the emergency room thinking that they're having a heart attack. It's when they come in an uncontrolled fashion and we develop the fear of the fear. because
Yeah.
that's what anxiety does. That's
Absolutely.
what panic does. It creates
Yeah.
this sense of doom and fear. I'm going to die. I got to get out of here. This is
Yeah.
going to last forever.
Yeah, yeah.
And so you have the cognitive process, the cognitions related to that, but then you also have the physiological experience, and the fact that it sometimes can come out of the blue mysteriously, can set up a whole series of events and cognitions that it becomes more chronic, or more of a clinical, what we would call a clinical problem.
Sure.
Yeah.
And how would you work with people who present with like a panic disorder like this, but someone who also has another mental health issue as well? But if they come to the hospital and they're working with you and they clearly have other mental health issues, but the major issue that you're dealing with right now could be the panic. Like,
right.
how would you help them in that situation?
That's a great question, Rob. And earlier today, I was just doing some supervision with a gal who runs a refugee shelter in Athens.
Yeah.
And she was asking about presenting concerns, because they're super complex clients that they have who've had terrible things happen to them and terrible psychosocial problems going on in the moment. And I always start with the presenting problem, and with the presenting, sometimes that's the presenting symptom, because that's why people come to a psychotherapist or a psychologist or a psychiatrist, is because they're experiencing such distress. And we want to alleviate that distress, So bipolar illness, for instance, is something that people have it, they accept it, and they accept at some point that it's a lifelong issue. So that can get better, it can get a little worse, but that you manage it over lifelong. They can have a panic attack. So you want to deal with that, first.
Absolutely.
So number one, you have to do an assessment.
Yeah.
And get the bigger picture of what's going on. But to treat it specifically, the first thing we do, I treated this a lot in group, or presented this in group, also to individuals as well, is to that's Bruno.
Hang on.
So the first thing we do, whether it's in group or individually with someone who's experiencing acute anxiety, or what we call panic attacks, is to basically have an educational process. And in group, it was kind of fun how I did it, because we would go around and I would say, I know people have like a PhD in anxiety here, or panic, and kind of to be a little humorous about it. And so we'd go over all of the symptoms, all of the physical symptoms that people have during anxiety, and list those out. And so they could range anywhere from people's vision narrowing, things going dark, people sometimes pass out, of course their heart is beating fast, they're turning red, etc. So we go over all of those physical symptoms. Yeah. So that was the first thing. The second thing we do is we talk about the thoughts that you have when you're starting off when you're starting to have those symptoms. And the thoughts that people have oftentimes are, oh my God, it's happening again. Oh my God, I'm going to die. Yeah. Oh my God, I got to get out of here.
It can be absolutely terrifying, a panic attack. It
exactly.
can be, yeah.
And so those I say, so we have these symptoms that we've outlined. We have these thoughts that get generated when we start to have those symptoms. And we develop a fear of the fear. So we're afraid of it. Yeah. And what people, what I tell them is that these thoughts that they have are illusions that the physiological state brings on. Yeah. Because in panic, you're not going to die. You actually don't got to get out of there. You don't have to go anywhere. And it's not going to last forever. Because I show them on a chart, actually panic attacks only last about anywhere between 2 and 10 minutes. Yeah. Now, some people experience one panic attack after another, but mostly it's that they have a single panic attack between 2 and 10 minutes. Yeah. And so I show them a bell curve chart, of how it lasts. It's at the beginning where they start to feel it. Maybe they're conscious of it, or maybe they're not conscious of it. And
Yeah.
It comes out of the blue.
Yeah.
It reaches a peak, and then it dissipates.
Yeah.
And so I draw all of that out for them as one of the first steps, or, get them to talk about it,
Yeah.
which helps them lose their fear and dispel some of the illusions that are created as part of that physiological process.
Okay. So you think like psych education is really, really important in helping them to understand what's actually going on with the physiology, what's happening in their head. And so when they understand exactly what's going on, then that helps them to be able to kind of deal with it better.
Right. That's the first step, because you have to remember is that you have to dispel any kind of false beliefs, whether they're conscious or unconscious, that have been developed around this experience that they might feel embarrassed about or shamed or think that they're going crazy when they're not. It's just an experience that they're having.
Yeah.
And you have to take into account that, they're only in the therapy office a very short time, compared to the rest of their lives. So people have to have those tools and information.
Yeah.
And then if the specific tool for calming down and re-regulating themselves, which I'll talk about in a second,
Yeah.
doesn't work, then sometimes people have other ways that they've found that they maybe read about or that they've developed over time that they can re-regulate themselves and calm themselves down.
Yeah.
But the key is not, is dispelling the fear of the fear. So,
Yeah, absolutely. About accepting that fear, accepting the fact that you're having a panic attack. There's nothing you can actually do about that in that moment. Your physiology, for whatever reason, is up, and your heart is beating fast, and
That's right.
and if you start to fight against that, you're going to make it worse.
That's exactly right. You fight against it, it makes it worse. So I tell them a little bit about the history of how because it gives people comfort that they're not going crazy of how this might happen, because a lot of people will say there's cued panic attacks and uncued panic attacks. I myself have had in my life 2 cued panic attacks, and one of them is hilarious. I used to tell, well, it was not funny at the time.
No.
But in retrospect, it was hilarious. There was a peeping Tom at a window when I was on the toilet, and I flew into an absolute panic attack where I couldn't speak, and my panic actually triggered my friend's panic when I couldn't explain what was going on. Yeah, it was like a scene out of a movie. So with cued panic attacks and uncued panic attacks, so acute panic attack is when we can see what might have caused it. So maybe we're doing a presentation and we started to get nervous and anxious, and then when we got up there, we started breathing funny, and our vision started to narrow, and we felt like we were going to have a heart attack. So that's a cued panic attack. We kind of know what the circumstances were.
Okay, yeah.
The uncued panic attack is when someone doesn't know why. They're just in this. Let's say they're in the grocery store and they're in the tuna aisle.
Yeah.
And suddenly they start to feel that little feeling that they get. Maybe the vision narrows. Maybe the sound changes. Maybe their heart rate goes up.
Yeah.
And they say, whether it's conscious or unconsciously in their head, "Oh, it's happening again."
Yeah.
It's happening again.
Yeah,
Which then with that
sets the whole thing in motion.
Exactly.
Yeah.
It sets it. You're familiar with this, aren't you, Rob?
Absolutely.
It sets the whole thing in motion.
Yeah.
Right.
Yeah.
So I usually tell a story so that in group, because of the fast-paced nature of this particular hospital setting, and we had to develop a rapport. I would tell a funny story about myself, or a funny story about a non-patient, someone who wasn't a patient, and then to show them that people have panic attacks. It's not a terrible thing. You're not crazy. You're not so different.
Yeah.
It's just that maybe you have gotten caught up in a cycle and haven't known what to do about it.
Yeah.
Okay.
Yeah.
And so then I say, okay, so I'm gonna give you.
Just for everyone who's listening in, if you can hear the sounds of a dog that sounds like it's very, very sad and having a terrible time, it's absolutely fine. It's my puppy Bruno, but for some reason he's under the table causing absolute chaos.
He's very excited to see me. He's a very excited puppy. And he wonders why I'm not paying attention to him and paying attention to this black microphone in front of me. So the sort of, I guess, third step that I would take is to say, hey, here's an idea, a little trick, so that you become a master of your panic attacks versus the panic attacks becoming a master of you. I'm not going to promise that you're never going to have another panic attack again. It's that you will have more, you know what they are now. And then here's a tool that might help to alleviate the intensity and the severity and the frequency of this thing you're having that interferes with your life and is a big pain in your bottom.
Yeah.
So
absolutely, yeah. Yeah.
So the tool that I suggest is that it's kind of old school, but like I said, my father-in-law and my uncle were psychologists, so I got a few tips from them along the way.
Yeah. No, the oldies are sometimes the best. No?
Right. You have to have a wristwatch with a second hand.
Right.
I suppose you could do it on your mobile phones with the timer, but there's just something nice about a wristwatch. I think it's a little bit more grounding.
Yeah.
So let's say that you're in the supermarket and you feel it coming on. You're aware of like the earliest manifestation, the earliest symptom.
So you might just kind of catch your breath suddenly a bit quicker than you would like to, or you feel your heart beating a bit, or suddenly your hands feel a bit kind of, sweaty or something. And yeah.
Exactly.
Yeah.
Exactly. And so, and catching something at its earliest possible manifestation, whether you're talking about panic or a temper tantrum, right, is probably good general advice.
Yeah.
So that's exactly right, Rob. And so just stop what you're doing for a moment. You don't have to run anywhere. And with your wristwatch, you take a look at it and you focus on that second hand and see, in fact, how long it's going to last. You're becoming a student. So you concentrate very carefully on that ticking second hand.
That's brilliant. Yeah, that makes sense. So you're becoming like more of a scientist, interested in what's going on.
That's right. And it's calming you down because you're focusing on this
Yeah.
and you're not focusing on the symptoms. Because what's happening also with anxiety is we're getting that over focus and that over attention on the symptoms and getting caught up in that. So, we call things mindfulness and this and that nowadays, but this is just focusing and breathing, slowing down.
No, for me, that is a bit of a mindfulness technique for sure, because it's kind of getting yourself out of your head a little bit. And one of the big things here, I think, is you're becoming inquisitive about your anxiety and about what's happening. You're kind of, instead of thinking, oh, I don't want to feel it, you're kind of saying, I'm going to feel it, and I'm gonna kind of time and see how long this lasts for.
Right.
And by having that kind of slightly different approach to it, you're kind of saying to yourself, it's okay to have this. You're making space for it. You're kind of allowing it to be there.
You're diminishing the fear. Around it. Yeah. And, just by nature, it's hard to do two things at once.
Yeah.
Through our life, we try to do it. We don't do it very well.
Yeah. But that's especially true for me, but maybe for other people too.
At the supermarket, we're going to stop shopping for which is the best brand of tuna for a moment, and we're going to stop everything, and we're just going to look at our watch. And it's also diminishes the embarrassment because oftentimes people feel embarrassed by this, and no one's going to know what you're doing because everybody's looking at like their phones nowadays. They're just stopping in the middle of everything. Yeah. In the way usually. Looking at their phone.
Very true. Very true. Yeah. Okay. And could you tell us a little bit about how you think anxiety and depression are related? Because obviously the two of them go together.
They do. And I'm not going to sing a song here, Rob, but this is what I say to my clients. Anxiety and depression are like love and marriage. They go together like a horse and carriage, which is an old song. It's on an American television, so a sitcom, but it's an old song my mother used to sing. Yeah. So basically meaning that anxiety and depression go together as a matter of fact, in the last revision of the DSM, I think, they were really wanting to add a diagnosis called anxiety depression disorder or depression anxiety disorder. I don't know. And it somehow got edited out. But clinicians know, people have been practicing that you usually have one, you have the other.
Yeah.
Anxiety, if you have prolonged anxiety, prolonged anxious states, say you have a tremendous amount of stress, problems, or emotional burdens.
Yeah.
Oftentimes, that can lead to an anxious state. If it becomes a chronic anxious state, often that leads to a depression.
Yeah.
Not necessarily a severe depression, but a depression. The brain is not at rest for prolonged periods of time.
Yeah.
And then a depression can develop. So it's pretty clear, like I said, to people, clinicians, and it was so clear in the research that a diagnosis was to be added. The medications that are used to treat depression, and there's a couple of different generations of antidepressants, but let's just talk about the newer ones, the SSRIs, etc.
Yeah.
Also treat the symptoms of depression, some better than others. And so, excuse me, did I say also treat the symptoms of anxiety?
Yes.
They're used for depression, but they treat the symptoms of anxiety as well.
Yeah.
And so it seems to be effective in that way. So again, when I'm working with somebody, especially if someone is, new to seeking some sort of help, or maybe knows only a little bit or not too much about what they might be experiencing, I have to start out in an assessment, of course, to see what the source of it is. Because if it's someone who may have bipolarities or a substance abuse problem, it's going to be different how it's approached. But let's just say it's straight anxiety and depression.
Yeah.
I'm going to start out with a psychoeducational or assessment piece and a psychoeducational piece of that.
Okay.
Is the basics.
Yeah. Okay.
And I like to see if everybody who's listening could picture a circle on a page. And in the circle, on the top half of the circle, picture a bunch of squiggly, scratchy lines on the top. And that's anxiety.
Okay.
So the symptoms of anxiety, which we know now because we've discussed. Rob can throw out some other symptoms out there as well. Okay. And behind that, those scratchy lines to the counterclockwise to the top of the circle are what I call problems, emotional burdens, and stress and stressors. So I draw little lines like steps on the circle just to illustrate those. It could be financial stresses, it could be work stresses, it could be emotional burdens that we're carrying from childhood or from maybe traumas even, maybe not something that caused symptoms of post-traumatic stress disorder, but things that were traumatic and very difficult. And so we carry those and we experience stress, we can experience anxiety. If those emotional burdens, problems, stresses are not addressed, and stresses could be, maybe we do have a chemical imbalance, as well. It's not just outside stresses. There could be internally based physiological brain stresses, so to speak.
Yeah.
If they're not addressed, we're going to continue to experience that anxiety.
Absolutely.
No.
So you think medication then is definitely helpful for some people?
I think medication can be helpful for some people, but if they're in super high pressure situations, maybe they're drinking too much, etc., medications aren't going to do much.
Yeah, absolutely. Yeah. It's like if you're taking antidepressants, but then you're drinking a couple bottles of wine every evening, then it's obviously going to have maybe more negative, like a more negative effect on you.
Or if we have social anxiety, let's say because of some core beliefs that we're core beliefs and core distortions that we're carrying around with us. We have the social anxiety that we've been carrying. Medication is not going to do it's not going to be the magic pill to get rid of the anxiety. It's going to be a combination of medications and specific kinds of psychotherapies and tools that might be helpful for that individual person.
Yeah, absolutely. Yeah, I think for me, like medication is at best a Band-Aid. And oftentimes just a placebo. I'm sure for some people there is a chemical effect that does help. Maybe boosting the serotonin in some way does impact and improve the situation for people. But from my own personal experience, medication wasn't particularly helpful for me compared to some of the therapy work that I did with various therapists over the years.
Right.
That therapy was the thing that made a difference in changing my thinking style, my habits of thinking over time. That was the thing that made the difference.
Right. And as you know from the experience of it, is changing our habits of thinking, our automatic thinking and behavioral habits are easier said than done and take a long time off. And oftentimes if we're experiencing outside stresses, that we maybe we have a period of abatement of the symptoms, but then something comes up and they might come back. So we have to either relearn or revisit those skills and kind of get a restart on things as well.
Yeah.
Absolutely. I think one of the misconceptions, I happen, because I worked in a psychiatric hospital, I happen to like medications, but however, there is a limit to medications for anxiety and depression. Oftentimes what they'll do is they'll give a person just enough of a break to put their brain at rest again, so that they can start to implement some of those tools and make some of those changes with the help of either self-help or with the help of a psychotherapist.
I completely agree with that. I think for a lot of people with OCD, that's where it can be very helpful to use medication, because for some people the symptoms are so strong, it's at such a chronic level that you kind of can't function normally at all. So to be able to start kind of thinking in a different way and to start doing ERP or to start doing acceptance commitment therapy when you're struggling so much with the anxiety from the OCD, it's incredibly hard. So if you can use that Band-Aid, if you can use the medication, even if it's only for 6 months or so, to get you to a place where you're able to start doing the therapy, then that's great.
And it's interesting, the 6-month mark or 9 month or a year is when we can have the realistic expectations for change. And so we want to get better quickly, but really it takes quite some time to learn these and apply these and actually see what's going on in our life, our life as a whole.
No, the process of getting better from anxiety disorders is not something that just happens overnight. It absolutely takes time, and it's constant management. It's not like you suddenly arrive to a place and like that's it. Now, like my OCD is cured and I can get on with life. It's like, no, it's like, like when you're feeling good, you probably won't notice the OCD at all or your social anxiety or whatever. But when you're kind of run down and you're tired and these are the times when it's going to come back. And if you're not ready, if you don't have the kind of, if you haven't done the work and the therapy, and if you don't have skills that you can turn to in those moments, that's when you can suddenly get stuck again and bogged down with the problems that you're having with the anxiety.
Right. And I think it's why it's important that educational piece is important, because people who struggle with a multiplicity of issues, including OCD or social anxiety, they can often see themselves as a failure if they don't have the right kind of psychoeducation and relapse prevention or relapse awareness. And then they think, well, nothing works. Nothing works. I always have this. Well, they've started out with oftentimes it's a failure of of education of it, is start off with a false idea that there's going to be a cure. It's going to go away forever. So that's oftentimes why psychotherapies and psychiatry gets a bad rap. They're like, well, we see it as the same way we would see an acute affection that you use antibiotics. Well, the infection's gone. Psychiatry and the brain don't work that way.
Absolutely.
If it did, I'd be happy.
Well,
here, take this.
Yeah,
right.
Absolutely, and probably we wouldn't be in need of so many psychologists and therapists out there, because the medication would be solving all the problems.
Right. It doesn't. It helps you to manage your symptoms. So.
And you were talking there about psychoeducation and how important that is. Mm-hmm. Do you think? I'm a teacher myself, and I know for a fact that in schools we don't teach children and young people anything about like mental health issues and how to be more resilient and how to deal with anxiety and depression and other problems. Do you think it would be a good thing if that was introduced into the curriculum?
Yeah, wouldn't that be nice?
Yeah.
Wouldn't that be nice? It's complex, though. It's part of my background is a really super strong background in clinical social work. I went to the oldest school in the U.S. for clinical social work, and that Freud lectured at.
Oh, wow.
Yeah, and back in the day, I guess it was 1920s or teens.
Yeah.
And that background leads me, when you see children and you see the complex environments that they come from and the stresses that they endure and that their families are enduring. Yeah. I think schools, at least my experience of public schools in the U.S., my limited experience, I had children in public schools. I worked to start a school. I was, involved, do so much for the kids who are presenting with such complex problems and stresses. Yeah. However, pieces on mental health would be helpful so that the child themselves can know possibly that they're not alone, that they're not going crazy, that they can get some help with it. And the counselors, the guidance counselors and social workers are sorely overworked in the school systems in the U.S. And the poor school systems have more problems because there's more complex problems when you throw in a little poverty. Yeah, absolutely. No, it's the same in the UK. Yeah. It's exactly the same kind of thing. Yeah. I think many teachers are amazing in that regard. Yeah. They put in like the extra time to really help spot the children who are struggling, and to get the educational psychologists involved and to get other agencies involved to try and help those vulnerable children with mental health problems, and that's fantastic. But I was more like kind of thinking it from my perspective. I kind of I developed kind of OCD when I was 16. But I had no idea at the time that it was OCD. I just had this intense anxiety, but I didn't want to open up to anybody about it because at the time I thought it was like, showing weakness, and speaking to somebody about it was not what a young man would do. Right. And so I kind of kept it to myself, and I didn't tell anyone about kind of what was going on inside and all these kind of terrible thoughts and like obsessions I was having. And I was completely lost. I thought I was going crazy, I kept it all inside for years. And I think if they gave some kind of basic education on kind of the symptoms of anxiety and some of the different kind of basic disorders that people can develop, it would help people out a lot. Because for a lot of people who seem to have OCD, for example, a lot of them don't get diagnosed until they're in their kind of, like mid to late 20s or even 30s. I think it could. I've never studied the implementation of educational programs, but it certainly seems like it could, because it's, what remains hidden gets worse. Yeah. Absolutely. Yeah. It gets habituated. And certainly early intervention, and the fact that these kind of issues do develop oftentimes at puberty, especially when there's a real strong biological base for them, whether it's severe anxiety, OCD, bipolarities. You're going to see some of the symptoms fairly early on. It's not going to be a full blown, and with the psychotic illnesses as well, you're going to see it, the ones that are biologically stronger, and it's important to intervene early.
Absolutely.
So
yeah,
it is.
Okay.
Yeah.
Interesting.
Yeah, that
Thanks.
would be great.
Yeah, it would be
in
great
an ideal world.
in the perfect world.
Right.
So with the patients that you've worked with over the years, have you seen any like dramatic turnarounds in regards to, like, it could be to do with bipolar or schizophrenia, or it could be to do with anxiety?
You know, I don't know if it's so much dramatic turnaround, but what really struck me in working at the hospital was the absolute brilliance of some people, in particular, I think, with bipolar illness, of figuring out and being able to describe what's going on in them, and then developing these ways to manage very severe case of this particular disease.
Right. Okay.
And so one in particular, I'll tell. So I was more impressed, and it like opened up my eyes to people. Oftentimes we would also see people. So just to say a little bit about bipolar illness. Bipolar illness is it's a sort of a spectrum disorder. It can be different types of severity. It's inherited. You'll see it in generations. It's related to schizophrenia.
Yeah.
It seems to be.
Yeah.
So says the science.
Yeah.
And it's accompanied by tremendous, a particular type of anxiety.
Yeah.
Is where the mind runs constantly. And that people will describe it as a treadmill. And it's accompanied by those physiological symptoms. So it's not even like, for instance, with worry and anxiety, it's not even clear thoughts or clear singular thoughts that are repetitive. It's sometimes many thoughts sort of talking in your head at once.
Yeah.
So,
Yeah.
And so I remember this woman who, in the hospital, sometimes people had to do medication changes because you can medications for bipolar illnesses and psychotic illnesses need to be adjusted probably every 6 months or so. Sometimes it takes a couple of years to figure out which one is going to actually work.
Yeah.
Sometimes the side effects are not tolerable. And so we would see people in who, for instance, had been on lithium throughout their life, and it was very effective for their symptoms. But then they had to go off of it because of, their kidneys were getting some damage from it.
Yeah.
And so they'd be in the hospital, and we'd try to restabilize them on a new medication. Sometimes they'd be in and out of the hospital a bit for 6 months or so. But this one woman was this very kind of case where she had been stable on a medication, but she had also developed like these incredibly coping skills for it, interpersonal skills. She had children, she had, a husband, a job, the whole 9 yards.
Yeah.
And she said, I remember she said, like, when I have, I know my symptoms are coming back when my thoughts are like ducks quacking in a pond, except they're all quacking at once.
Yeah.
I loved it. I think it was my poetry background that that one stuck in my head. So over the years, I would have people who just had incredible insight and incredible coping skills to deal with these issues that have a persistency. Let's call it. I don't want to call it chronic.
Yeah.
Even though we do clinically, but they had persistency.
Okay.
Is that a word?
Yeah.
Oh, okay.
Yeah. Well, persistence. Yeah.
Persistence.
Persistency. Yeah.
That was my. I have to ask the teacher here. Is that really a word? So.
Okay. And very complex as well. Obviously, like each individual with bipolar, I guess similar to other disorders, but particularly I imagine with schizophrenia and bipolar, they can be so complex.
Yeah, people are people first, and then when they are struggling with this particular problem that has a biological, neurological core to it, they're people first, and the manifestation is, and how we're going to approach it and deal with it is really about the individual.
Yeah.
Yeah.
Absolutely.
Did you want me to say a little bit more about the depression and anxiety cycle? So what with the cycle of anxiety and depression, when we visualize a circle, and we have that anxiety at the top, we have the emotional burdens, the problem stresses over to the left, that are behind or fueling the anxiety, our unresolved problems. chronic anxiety is the brain not at rest, and it also puts us into a fight, flight, or freeze mode.
Okay. Yes.
Oftentimes.
Yeah.
That anxiety.
Yeah.
And so some people go into the fight mode,
Yeah.
and they are going to be more irritable, difficult, maybe more volatile. I remember hearing a podcast on a soldier who had come back from Afghanistan, and he said, I was anxious, somewhat traumatized and anxious. My solution to that was to get drunk and start fights, which he found temporary relief from those symptoms. But of course, he ended up on the circle, more problems.
Yeah,
because he was in that fight mode. And a lot of people find themselves caught up in that particular cycle where they're, they're doing things that are making the problems worse. So they're in a fight mode or a freeze mode. So after some time, if we look at the bottom of the circle, we cycle down to the bottom of the circle, we have the chronic anxiety. It can turn into or lead to a depression where the mood becomes low. We may start isolating ourselves. Maybe we're fearful in isolating ourselves with that anxiety. We need human contact. We're not eating right. We're not exercising right. We're having suicidal thoughts, possibly. And then you have the cycle of depression, which is a low mood. The mood goes down chemically, right? It's anxious and it goes down. And then it triggers negative thoughts. I call it stinking thinking. AA calls it stinking, Alcoholics Anonymous, stinking thinking. Which are a set of particular types of thoughts that if I were to give anybody who has suffered with depression before, they would recognize those thoughts because we all have them in us. But what happens at the bottom of this circle is another little cycle called the depression cycle. Negative thoughts, mood lowers. More negative thoughts, mood lowers. I'm isolated. Negative thought, mood lowers, and we get trapped in that cycle down at the bottom of the circle.
Absolutely,
right?
Yeah.
So then we think, if we're conceptualizing this circle, it's like, how are we going to break out of that cycle? How are we going to step out of that cycle step by step? So if we're going clockwise now, and we're looking over at the bottom and to the left clockwise at, let's say, 7 o'clock, or what hour? 19. For those of you on European time, military time, right? Is that we need to say, what is the first step that we can take here so that we've lapsed into this cycle, we've lapsed into the full symptoms. What's the first step here that we can take to help break the cycle? Well, for some, it depends, of course, but I'll name a few. For some, it might be they've already taken the first step, so we need to see what they've done to help themselves, because we want to play on that strength. And everybody has helped themselves. Even some of the weird things that people do, I don't know if weird's the right way, but some people are like, what? They did what?
Well, it's interesting when you mention alcohol, and for an alcoholic, obviously drinking alcohol in a funny kind of way, that is that person helping themselves, because they are going to feel better, at least initially.
That's exactly right. Well, why would people do it? I mean, I don't want to sound like a Freudian here, but let's talk about the pleasure principle, right? Yeah. We're trying to get our state, the state that we're in, into feeling better. And alcohol, results in a release of serotonin. It can be measured in the spinal fluid, and so, but it's ultimately a depressant. So it makes the cycle worse. But yes, of course, when you fight, there's a release of adrenaline and endorphins and all kind, and we felt high. Look at the Fight Club. Right? That movie. A lot of the things that we do, even people who are suffering very, very severely, and they engage in self-harm behaviors like cutting, for instance, they're actually doing that oftentimes too. So these unusual behaviors, they're often doing that to find relief from the symptoms, relief from the anxiety, or in cases of a trauma or traumatic memories, is trying to find relief. They're basically trying to change that emotional state or that mood state. And so the strangest things usually are an attempt to feel better in a general sense.
Absolutely, yeah. Yeah, that makes sense.
Or feel differently.
Yeah, well, sometimes that's the thing. Like if you've been feeling anxious all day, every day for the last week, then you want to do something. You want to snap out of that somehow. And if alcohol or having a fight or whatever measure works, then, maybe that's feels like the right thing to do, even though it has, a negative consequence further down the line.
Well, this is why you brought up psychoeducation is so important. One of the interesting things about this interview with this soldier who said that, drinking and fighting was his solution to his anxiety is he said he unfortunately had his commanding officer was someone who was very negative about seeking mental health help, and saw it as a weakness. And so that was one of the reasons why this guy didn't seek out help at first, because he felt it had shame and stigma around it. He was a tough soldier.
Yeah, it's ridiculous that we're still at a place in society where a lot of people still think like that. I think in general it's got better.
Yeah.
And like social media has helped with that.
Yeah.
If you go onto Instagram or Facebook now, you often see, kind of memes and videos and people talking about this kind of stuff. And that's really good. But there's still a stigma. And particularly for men, even more so, I think.
Yeah, I think so too. And men are at high risk. They're at high risk for, deadly suicides, completion of suicide, and there's no reason for it. It's not a solution, and to get back to the stepping out of it. So we look at those on that circle. How can we break the cycle? Well, the first thing could be medication management. Another thing is getting support, learning particular tools to lower the symptoms, resolving and re-narrating some of the things that happen to us so that we see it a little bit differently. Resolving thoughts or beliefs that are not serving us well, like we have to be perfect. I can't express what my needs are. So it could be any number of steps that we take, so that we have enough strength then, right? We're taking the steps, we're relieving some of the symptoms, and then we have enough strength to walk up that side of the circle clockwise and to be able to reduce the stresses, resolve the problems, and sort of re-narrate or resolve those emotional burdens, and know that we're not alone in this, and there's help out there, so that we lower that intensity of that anxiety, the things that are fueling the anxiety.
Yeah, when you feel like you have support, when you know that there's someone there on your side who's willing to help you, that's that's a huge part of it.
Yeah, and the nasty thing about things like depression and anxiety is that they make us think that there's nothing out there to help us. It makes us think that we're all alone. It makes us think illusions, I'd like to call them, that there's no one, that we're the only ones who have experienced this before. It's just it's sort of the nature of that disease process, as it makes us think we're alone. And then you combine that with social stigma.
And it's multiplied.
It's really bad. That's why group psychotherapy, even though it's out of fashion, except for like self-help groups, have become, that's the sort of the spawn of group psychotherapy, Irving Yalom, is self-help, and it's tremendous. I think AA is one of the most important social movements that have ever happened.
Absolutely, yeah.
And because people go to AA, they've been sober for 30 years, they like the camaraderie, and they focus on the cognitive aspects of, how not to engage in the stinking thinking, which can lead to a depressive state or a relapse.
Yeah, no, absolutely. Some of my favorite podcasters actually are AA members, and people like Russell Brand, Rich Roll. These people who have just completely, changed their lives and now live an incredibly positive and meaningful life.
Yeah.
Really connected to their values and spirituality. And,
right.
And it's amazing how AA is so helpful to so many people. But actually, right now, some people are kind of dissing it a bit and saying that it's kind of outdated and not useful. And actually, I think, when you really look into it, it's an amazing organization, and it's so helpful.
Right. If people are, tell me what you think will be helpful for you.
Yeah.
You let me know, and we'll figure it out.
Well, it's true. That is true as well. Because at the end of the day, it's whatever you find helpful. If you go to AA and it doesn't sit with you, then it doesn't sit with you, and it's probably not going to work for you.
Right. Yeah. Or go to a different AA group. You might like that one.
True.
Maybe they have better snacks.
That's probably the most important thing of all.
I think snacks are important.
What advice would you give to somebody who was at the very bottom of the anxiety circle that you were talking about, and also kind of stuck within the bottom half of the depression, the smaller depression circle that was at the bottom of that? Like, if they're stuck right there at the bottom, they're really lost in that depression. They're kind of, their negative thought patterns are keeping them from asking for help, and they kind of feel that hopelessness that comes with depression. Like, what advice would you give to somebody like that?
Okay. Reach out. You're not alone. And right now your brain is telling you that you can't connect with people and you can't reach out, but you can. And also, if, let's say, terrible things have happened to you, because terrible things do happen, you are not alone, and you're a survivor too. You survive these terrible things, whatever they are, because there's some unusual things and some terrible things that happen. And not only have you've survived so far, you've done something right. So I reach out to a friend, reach out to a professional, and figure out what you have done right and to survive so far, and we'll work on that and make it better.
That's fantastic advice. Thank you very much for that. That was very good.
Yeah, well, people feel alone.
Yeah.
And, over the years of working in circumstances that scare me, like the situations scare me, what I've learned is that people survive terrible things, whether it comes from an unfortunate genetic inheritance, or from things that happen because they've been in terrible situations, or maybe even self-inflicted terrible situations. We make mistakes. We make big mistakes sometimes, but we can survive it. Yeah. We can survive it and figure it out. All is not lost.
Okay, so for reaching out for that help and that support is absolutely key.
Yep, and remember, your brain is telling you that you are alone, but you don't believe everything you think right now.
Yeah.
Don't believe everything you think, because your brain is making a mistake. There are people out there.
Absolutely. Absolutely. Yeah, that's so true. When you're really bogged down with anxiety or depression or whatever you're suffering with, it's your brain is telling you lies constantly. It's telling you the worst side of the story constantly. It's so biased. And to recognize that, even when you're in the throes of depression or anxiety, to recognize the fact that your brain is biased and is telling you a one-sided story, so that you can at least say to yourself when you're feeling terrible, I know that this is just my brain telling me this. I do feel terrible, but at least when you say that to yourself, it's helpful, no?
Absolutely. And that's exactly one of those I remember in group therapy, someone saying something that I tell myself that it's just my brain and I'm seeing through these particular lenses right now. It is not me, and my brain is lying to me.
Yeah.
And it's hard to see alone. We can't see it. It's hard to step out of this alone. It requires another person. It really does. Part of why it requires another person is because we exist in relation to other.
Yeah.
And we survive. Infants don't survive. Well, we've learned with this puppy how needy he is. But even infants require the consistent gentle, loving, responsive care of another human being, one or two other human beings, in order to actually thrive, to live.
Yeah.
So, and so we still need that now. So
absolutely, yeah. I think connection is so important. It's one of the most kind of undervalued things in relation to mental health.
Absolutely. And the whole basis, I mean, we can kind of, laugh a little bit about some of the outdated Freudian theories when, psychology was at its infancy. But, they did have something right at its core, is that we had the talk therapy, right? The talking cure. It was, I think it was called. And so we have to be in a dialogue and connect it to somebody else in order to walk, to manage, to survive, and to walk ourselves out of a terrible moment.
Yeah.
So,
yeah.
And we have to think of it as a moment.
Yes.
It feels like forever, but it's a moment. Could it be a year? Could be a couple years? Could be a month? But it's a moment.
So having that awareness that, everything will pass in the end is incredibly important.
It is important. It is important. Yep. Yeah.
Yeah. Nothing's ever standing still.
Right.
Yeah.
And we can develop more and more skills, even if something is a bit persistent, to be able to manage it.
Yeah.
So.
Yeah. Okay. Do you have any if you could only give kind of one piece of advice to people who are struggling with anxiety disorders, what advice would you give?
One piece of advice. Well, okay. Here's my quick and dirty tip. Okay. and it comes from, and I don't know if it's exactly right, but my quick and dirty. I always disliked physical exercise. I grew up in the South in the U.S. It was hot. I happen to be very fair-skinned, and I get overheated very easily. So I was disinclined towards exercise.
Yeah.
So, but exercise and diet can help to, intense exercise is one of those things that can help to control or contain symptoms of anxiety. It has almost an immediate effect. So people are always like, I just can't stand this. I want to get rid of this. And that's why, unfortunately, especially at one time in the U.S., a real proliferation of benzodiazepine use, which, by the way, is not a good long-term solution for anxiety.
Not at all, no.
Yeah. It'll bite you in the butt if you try to get off of it. I've spent a lot of time working with doctors trying to get people off these benzodiazepines and hypnotics.
Right.
As well, Ambien, etc.
Yeah.
But intense exercise can help temporarily to get some of that relief. So that's a tip. I like sometimes quick solutions. There's other things that can get quick relief. There's something called a dive response, where holding your breath and immersing your face into icy cold water can help to relieve. I think it's called in dialectic behavior therapy. TIP.
A bit of a Wim Hof kind of method for dealing with.
Right. Can alleviate those acute symptoms.
Yeah.
Making kind of physically changing the body, the breathing, oxygen.
Absolutely.
So,
Yeah. No, both those methods, I know personally, for me, really work.
Yeah.
Exercise is an absolute game changer for what it was for me, and it is still. Like if ever I'm feeling kind of a bit jittery, or the anxiety's kind of I wake up in the morning and I'm feeling like that anxiety, then I'll just go for a run.
Right.
And, like I will come back and I'll feel so much better straight away.
Right.
And be able to get on with my day. And like, maybe there'll be a little bit of residual anxiety, but absolutely
Right.
fine. It's something that you're able to deal with. And there's something to do with the exercise. All the research shows that it's really beneficial for anxiety. It's like a natural antidepressant.
Right.
And it doesn't have the side effects of a lot of the medication.
Right. So for all you couch potatoes out there like me, 'cause I could sit for hours and not do anything. It was sort of I know the research says it, but my aha, moment as well. So you don't need to run a marathon. Do not. So if your stinking thinking is telling you, well, I'm out of shape, I can't do that. Well, sure, you can do something. You can walk out. Well, some people still have mailboxes at the end of their street, I suppose. You could walk out to the end of the block. Seriously, just get out and walk quickly around the block. Because if you're out of shape, what's awesome is the exercise doesn't have to last long, right?
No, not at all.
Because your heart will go up very quickly when you're out of shape. And get yourself a little bit out of breath.
Yeah. Even just running up the stairs 2 at a time.
Yep.
That's really helpful, and that really
come
gets
on,
your
Rob.
heart
That
going.
sounds like overachieving to me. I'm just going to walk up. You're younger than I am. I'm just going to walk up those stairs. That gets my heart beating. So, to 15 to 20 minutes of exercise, and you're going to get that response. And that could simply be walking quickly for somebody, or even not quickly.
Yeah.
Who knows?
Absolutely.
Right. If you can't walk, I was working with someone who can't walk because of feet surgery. You can blast up the music. You can get maybe a half kilo or a quarter kilo of rice and put it in containers in each hands, and then shake it to your favorite music, and get exercise that way.
Yep.
That's exercise too.
Absolutely. Yeah.
But that's great for a quick relief of anxiety.
Okay. Great tip there. Thank you very much, Lisa. It's been fantastic talking to you.
You're welcome. It's been great talking with you.
Yeah. Remember, if you want to know more about me, you can check me out on Instagram, Robert James Coaching UK. You can go and join the Facebook group if you like, the Robert James Coaching Anxiety and OCD Support Group. And also you can check out my website, www.robertjamescoaching.com. Many thanks. And now just a quick reminder of my disclaimer. Any information that you view on my website, Instagram page, Facebook group, or anywhere else online, or any information that you listen to on the podcast is for informational purposes only and is not intended to be a substitute for actual medical or mental health advice from a doctor, psychologist, or any other medical or mental health professional.